Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then uses of nitrates. Nitrates can be given in vasospastic. They can be given vasospastic or Prinzmetal angina. Nitrates can be given in vasospastic and Prinzmetal angina, but the drug of choice for vasospastic and Prinzmetal angina is calcium channel blockers. Actually, the nitrates are the drug of choice in acute attack of angina. They can be given in acute attack of angina, and in fact, they are the drug of choice for acute attack of angina, and they are not effective in prophylaxis of angina. So nitrates are only given in acute attack of angina and not in prophylaxis. Now, what is the drug of choice for prophylaxis of angina? The drug of choice for prophylaxis of angina is actually the beta blockers are the drugs used in prophylaxis of angina. Okay, one more important thing. We have variant angina or vasospastic angina. This variant angina, which is also called as vasospastic angina, which is also called as Prinzmetal angina. Okay, the in this vasospastic angina, Prinzmetal angina, the drug of choice is calcium channel blockers. Nitrates can be given for the treatment. These are not contraindicated, but beta blockers are contraindicated as they precipitate the vasospasm. So the drug of choice for vasospastic angina is a calcium channel blocker, which is mainly the verapamil. So this is about angina. So angina, the acute attack, the drug of choice for acute attack of angina is actually the nitrates are the drug of choice for acute attack of angina, but they are not effective in prophylaxis of angina. The drug of choice for prophylaxis of angina is beta blockers. Then we have variant angina, vasospastic and Prinzmetal angina. The drug of choice for this variant angina, vasospastic or Prinzmetal angina is calcium channel blockers, which is verapamil. Then nitrates can be used for the treatment of Prinzmetal angina, and in Prinzmetal angina for prophylaxis. For treatment, the beta blockers are completely contraindicated in Prinzmetal angina. Then, one more thing. Drug of choice for acute attack of angina is nitrates. Fine. Which nitrate? It is actually sublingual glycerol trinitrate is the drug of choice for acute attack of angina. Then the drug of choice for prophylaxis of angina is actually beta blockers with oral nitrates are better than beta blockers alone. You can, if the option is given has beta blockers with oral nitrates, then it is a better option followed by beta blockers. Then if the patient has acute left ventricular failure, in acute left ventricular failure nitroglycerin can be given in IV. Okay, next, cyanide toxicity. If the patient has cyanide toxicity, then the drug of choice for cyanide toxicity is actually a nitrate, which is amyl nitrate or sodium nitrite. Amyl nitrite or sodium nitrite, this is nitrite. Amyl nitrite and sodium nitrite are the drug of choice for cyanide toxicity. And one more uses, these nitrates can also be used for biliary colic. We can use them in biliary colic, or we can also use them in esophageal spasm.
thank you and thank you for watching.